The views and opinions expressed by the following program and its participants are solely their current opinions and do not reflect the opinions of Bobo 89.1 FM and DMS Broadcasting respective stations. The program participants' opinions are based upon information they consider reliable and based on their knowledge.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
Once again, we thank you for tuning in. It's another exciting episode of Healthcare Today with the HSA. I'm your host, Chuck Taylor. And as always, we bring to you some of the wonderful professionals over there at the Health Services Authority. And we're talking about everything that is required to make your life a little bit easier, get you in the right path, and also, give you some idea of what wonderful services they have over there at the HSA. And today we're talking to Miss Kristina. She's going to tell me about, and I'm going to struggle with this word. I know it has arthritis into it, but what's the official word for this?
So the official word is osteoarthritis. But
Osteoarthritis.
Osteo means bone.
Okay, so arthritis of the bone. In a nutshell.
Yeah.
Well, okay, we're going to dive into Miss Kristina. Go ahead and introduce yourself to our wonderful public.
So my name is Kristina Bramwell. I'm one of the physiotherapists in the Therapy Services Department at HSA. So therapy services actually encompasses more than just physiotherapy. I want to start and say that because I think a lot of times we get called the Physiotherapy Department, but realistically we have physiotherapists, we have occupational therapists, and we also have speech therapists. So it really is the Therapy Services Department.
Okay. So there's a lot of other encompassing areas of the therapy service.
Correct.
But you deal specifically with the osteo, which is the bone part?
Yes. So September the 8th is World Physiotherapy Day. So it's a day that we just, celebrate and educate the public about the benefits of physiotherapy, also called physical therapy in some jurisdictions. So the theme for World Physiotherapy Day 2022 is osteoarthritis. So that's why we're talking about that specifically today.
Okay. So the acronym of course is OA. So what is OA?
So OA, osteoarthritis, is basically normal wear and tear in joints that can affect bone and underlying cartilage. So it happens to most people, which is definitely what I want to start by saying, because I think a lot of times people go to the doctors and they get this diagnosis and they hear it and it sounds like this huge life sentence, and it really isn't. So Chuck, if you went to the doctor and your knee was hurting and they did a X-ray, ultrasound, whatever imaging they decide to do, and your doctor came back and was like, Chuck, you have osteoarthritis in your knee. How would you feel?
I would be very scared.
Right. And rightfully so, but at the same time, it's something that's going to happen to most people.
Right.
So I think we need to stop looking at it like it's this huge, deep diagnosis.
Okay, I see where you. So I've always thought of things of that nature, arthritis, now osteoarthritis. When I hear that, I automatically think, oh my God, it's just me. But this is something that happens to quite a few people on a normal basis.
Correct. I hesitate to say it's going to happen to everyone because obviously I've not met everyone. I've not read every study that there is, but it's going to happen to majority of people. What dictates how bad it is genetics. Genetics play a huge factor in everything, and also lifestyle. So for example, if you're someone that say has done a lot of, you play a lot of basketball, you were playing basketball in high school, and then you were a semi-professional basketball player, and now you're a recreational basketball player. Your knees, for example, take a lot more pressure than someone who, say, was a baseball player, because then their shoulders are maybe going to take a little bit more pressure.
Okay, right. And a lot of times this is in addition to actual wear and tear of living. This is extra curriculum, and not to say only, but that increases the chances of you developing this.
Right. But even if you were, say, a sedentary individual, you're someone that doesn't do much, it's physically impossible to use your joints and they not wear down a little bit.
Okay.
And also, too, I think a lot of times people get caught up in the diagnosis because, they're having some pain, they go and do imaging, they get this diagnosis, when realistically how the images look, like the x-rays and the ultrasounds, even MRIs, the pictures don't necessarily paint the picture of the person. So, for example, I am currently having no pain in my body other than, general life pain of being alive, right?
Mm-hmm.
But if we, say, x-rayed my spine, there's probably some wear and tear there, but I'm not having any issues, right?
Okay.
So, again, the images that you get don't necessarily line up with how you present as a person. Mm-hmm. So, physiotherapy really looks at the person as a whole. What is your lifestyle? What would you like to do? How are you functioning in your day-to-day world? And then we try to rehabilitate you according to that. We're not just going to say, oh, this x-ray looks awful, so you're done.
Okay. So it's almost a very customized understanding of your body and what ails you and what can possibly build up based on how you live and things of that nature. It's very, very specific towards the person is kind of what I'm hearing. Because, okay, take for me, I'm a sit down most of the day, but then I do carry a pretty heavy backpack to the point that, it's laptop, it's computer, it's all of these instruments, it's all these connections, it's recorders and things like that. I literally, over the years, made it a point to say, okay, you know what? Let me lighten my load, because at one point in time, a couple of years ago, I had a back issue.
Mm-hmm.
And now I'm thinking, I did have, and back then it was titled just physiotherapy for, I had some pain in my back, and they say, oh, you have a pinched nerve and this nature. But it could have been, if I looking at it a little bit more, could have developed into something more.
And a huge component of physiotherapy is educating people how to change their lifestyle so that whatever gains that you make in physiotherapy can be maintained, right?
Okay.
Because ideally, we don't want someone to become a frequent flyer, right? You should be able to rehab the situation and then, barring unforeseen circumstances, be able to kind of handle yourself better if the same issue arises. And a lot of times it's really, really simple changes that can make a huge difference, and people don't stop and think about that, because pain obviously is pain. It's very subjective. It's very individual.
Yeah. And some people may have a higher threshold.
Correct.
Than others. So it'd be like, oh, I it's a little pain, but I can live. I'm walking in, I'm fine with it. And then that same pain may be on a scale of 1 to 10, maybe a 9 for somebody else, where you deal with it as a 2 or 3. It just depends on the individual.
Yeah, very correct.
Very subjective to it. So, as we're talking about it, who would get more, as you said, more of the doctor saying, okay, you know what, I have a knee problem and I'm a basketball player, or a shoulder or something like that. We have in our country, I say a lot of runners. So do you see a lot of knees and ankle and foot that needs therapy on that level? Because I see that as kind of the I don't want to say the go-to sport here because we have a lot of sports, but just one that is very active. I hear about runners and injuries of that a lot. Is that one of the things that you look at?
We do treat runners. Obviously, they come through as part of the general population that we see. But to be fair, like staying on the topic of osteoarthritis, those are typically not the people we see with it as much. Okay. Because someone that, say, is an avid runner and is serious about their running actually usually makes an effort to take good care of themselves, right?
Okay.
So that person is doing cross training, like instead of running every day, they're doing a little swimming sometimes so that they offload their lower body a little bit, or they're making sure that they change their shoes every 3 to 4 months so that their feet are really well supported. They're making sure that they're in the gym lifting weights and strengthening the correct muscles and things like that.
Okay, I see now. Osteoarthritis is how would you separate that from the sports and things of that nature? Is it something that because when I think of arthritis, I think of hereditary arthritis. I don't hear of bone arthritis. I think this is the first time I'm actually hearing it coming from you. Tell me a little bit more about that, so I can, if I can understand it, I want my listeners to kind of have a better understanding of it also.
Right. So going back to that runner example, I mean, that runner is probably still going to have some level of osteoarthritis eventually. As like I said, very few people are going to escape it completely, if anyone, right? Because again, your body is essentially a very well put together machine, right? The main difference between our body and, say, a mechanical machine is that your body has the capability to change and heal, whereas machinery doesn't, right? You have to change, you have to physically change it, right? It's not going to change on its own based on the demands put on it, right? So that's the big difference with the body. But at the same time, your joints are going to wear down to a point. Like a 15-year-old's joints do not look the same as a 75-year-old's joints. It's just the way it is. Your body changes, it ages. That's what happens, right?
Okay.
Again, using the running example, typically that person, if you compared, say, a 60-year-old runner to a 60-year-old sedentary person, they might both have some level of osteoarthritis, right? Because it's what's going to happen to a 60-year-old person that has been living for 60 years. But a lot of times what you actually find is that the runner might actually potentially have less because their muscles are stronger, so the joints are better supported, so they might not wear down as quickly. Okay. That person is typically, again, I really dislike bringing weight into the conversation because I feel like a lot of times we get very caught up in weight. Okay. But at the same time, a runner is typically going to be at a healthier weight than a sedentary person. So again, there's less weight going down through those joints, so they don't wear down as fast.
Lifestyle plays a huge determination on it. What would be some of the signs and symptoms that you could look for? Say, what would I look for to say I should go to the doctor, and this may be something that is OA? What would I look for?
So pain, obviously, but like we said before, pain is very subjective, right? So, but pain is definitely a symptom. Swelling, okay? If a joint looks kind of hot, red, swollen, that can be a sign that something is going on. Also, decreased what we call range of motion, right? So if you notice that, hey, my knee doesn't feel like it's bending or straightening like it used to, because again, you would notice that more than someone else, right? Because you're used to how your body moves and how it functions in the world, right? So decreased range of motion. You can sometimes hear arthritis. Like I'm sure you've heard, maybe even in yourself, like sometimes you move and something will kind of click or pop.
Yeah, click and pop.
That doesn't necessarily mean something's wrong, because sometimes, your body is going to make noise as it moves. But typically arthritis is also noisy because now it's two kind of rough surfaces rubbing against each other as you move.
So you have almost a bone touch, rubbing bone type of scenario.
Yeah, for lack of a more scientific way of putting it. Yeah, definitely, right? So sometimes the clicking and the noise, kind of grinding, crunching can also be a sign. And then some people, again, in advanced cases, you will start to see like deformity. Like I'm sure you've seen some people where their fingers and toes, especially because they're very small joints. So they get affected the most because there's not as much surface area, right? So I'm sure you'll see some people that their fingers look like they're kind of bending and kind of sticking a little outward. Or maybe they're staying kind of bent, like they don't look like they can fully straighten, almost like they have a nodule there.
Yeah, like it's bending to left or right, but it's moving in that direction.
Right. So those are the main signs and symptoms.
And would you say because of, over the years, a lot of jobs have become more computer sedentary based. We're not moving as much. Do you think that may, in a slight way, show, as you said, you see it in your hands? I know a lot of people do, a lot of typists over time. You see just the difference in their hands. Could that be a building towards this ortho? I keep messing up the word.
Okay. You can say OA.
OA. Yeah, that's a shorter route for me right now. Maybe that is something that to look at as a thought in the mind, to say, hey, maybe I need to look about this, because once again, we don't see it and we don't feel like we're having a problem, but it is building over time. I mean, one of the worst things is that you have this pain, chronic pain, and you don't take a look at it because it's a dull pain. But is that something that we should be aware of?
Definitely. A lot of organizations, usually the bigger ones, of course, because they have the money to do these things, are really taking pride in workplace ergonomics. So ergonomics is the study of how your body moves in your working environment, right? So a lot of big companies are, now getting sit-to-stand desks and ergonomic chairs with good back support and neck support and stuff like that. And those things are definitely helpful. But the key is that the human body was meant to move, right? Early man, even though they didn't live as long as us, because, obviously now we have technological advances, were hunters and gatherers and moving, but now because technology has advanced, most people are sitting down. Like, I have the luxury of having a very movement oriented job, but I'm definitely in the minority. Most people, like you said, are literally sitting behind a computer for the greater portion of the day. I have a friend that I actually work out with, and we were doing like a step challenge last year where we were trying to get 10,000 steps a day. And she was saying, like, when she goes to work, like, she could literally get less than 1,000 steps in her 8-hour workday because she's literally behind a desk the whole time, right? So it is a challenge for people to move, but movement is good for you. Movement will actually help prevent osteoarthritis to a point, because weight bearing through the joints and stuff like that actually helps prevent it, even though it seems a little counterintuitive, because obviously I just said that wear and tear is going to happen anyway. But weight bearing exercise and movement has actually been shown to prevent it. So like I said, that runner that's 60 years old versus that sedentary person, even if they both end up with osteoarthritis, the runner typically actually is probably going to have a little bit less, even though to the lay person you may think, but they're putting all these forces through their joints on a regular basis. But that's actually a good thing. So, people and places getting into these ergonomic spaces where you have a sit-to-stand desk, so you can stand a little bit and then you can sit a little bit. You raise your desk up and down so that you're comfortable. I've seen a few office places now where they have what you call a pedal ergometer under the desk, so it's a little bike almost, and you can be pedaling but still at your computer.
I call it rock and roll, where you're riding and you're moving the lower part of your body while you. And I think we live in a society that unless we talk about it, we tend to not recognize it or even realize it. Like I said, in my lifetime, I've known of arthritis, but it's just been arthritis. There hasn't been a breaking down into any kind of specified or anything of that nature. So now that I know it, I'm going to make an effort to be more movement orientated, because hey, I'm literally at a hot seat. And when we joke about radio, we say hot seat, but I'm literally in a seat and I'm here for my 4 or 5 hour shift. But I try to get up and move around, get coffee. But then I'm thinking, I need to move a little bit more now, because I'm getting up there in age. I need to I need to be visual of it, because every little bit kind of helps towards the right direction. How do you diagnose OA?
So as a therapist, we diagnose OA, like I said, kind of based on those signs and symptoms that we discussed before. Typically, though, especially in our healthcare system here, obviously different countries have different rules for how you access therapy. But here in the Cayman Islands, most insurance companies require that you go to the doctor first, and then they refer you to therapy, and then your insurance will pay for it.
Oh, so insurance does cover a bit of this, if
Correct.
not. Yeah.
Correct. Like I said, there are a select few insurance companies that allow you to do what they call like direct access, where you can go to the therapist first if you feel like you have a need and then they will pay for it. But majority, I would say 90% of insurance companies do it the other way, where you go to the doctor first, the doctor diagnoses you, and then they refer you to therapy. So usually how your doctor will diagnose it is they will take an x-ray. Obviously, you will see certain changes on that x-ray that will, help the doctor come up with that diagnosis. You can do an explorative ultrasound as well. Slightly different ultrasound than what you do for prenatal services, but similar technique. But this type of ultrasound will visualize muscles, joints, tendons, that type of thing. It can be diagnosed that way. It can be diagnosed through MRI, etc. So it's usually looking at these pictures of your joints, and your doctor obviously knows what a quote unquote normal joint for someone of that age and stage in their life should look like. And then if yours is obviously different from that, then they will grade you, okay, mild, moderate, or severe.
And as you said, based on the grade, mild, moderate, and severe, the pain level, I'm assuming, and maybe even the difficulty in the range of motion,
right,
would be a lot based on this mild to severe. Based on what you see, walk me through a little bit of the, I guess I want to say our island, because I'm sure you worked other places, but how severe is OA here? Is it? I mean, of course, we say it's naturally going to occur in our lifetime. How much people actually come in and acknowledge that they have it, that they come in and see, okay, you know what, our patient load is quite heavy because K-Man recognizes and sees this, or how does that work?
So we do have quite a few OA patients, and again, they seem very, very surprised by the diagnosis. So I think it is a lack of education, obviously, in the community at large about what OA is, right? Like you said, right. This is the first time that you've heard it kind of broken down like this, and you seem like a worldly, educated, out there type of person, right? So again, I would say that probably, the general lay person probably is in a similar boat or even less educated about it, right? So we definitely do have a lot of those patients, and a lot of times the beginning of therapy is a lot of education and getting them to sort of buy into the service and how we can help them, because they have in their head, this is this, disease now that they've been diagnosed with, and they're surprised and they're scared and they're, all of those things combined with the pain. It's a very almost kind of unsure / maybe even frightened person coming into therapy, when it is, osteoarthritis, even severe osteoarthritis, is not a death sentence by any stretch of the imagination. A very severe case, I mean, I'm sure you probably know people that have had knee replacements and hip replacements. Like those are quite common, right? But even joints that are that severe that necessitate a replacement, can definitely benefit from therapy prior to the surgery. Because again, the healthier you are, the less pain you have, the more movement you have going into a surgery, the better you're going to be coming out of it. So, there's a part of therapy that we like to call prehab, right? Like pre-rehabilitation. It's like, you're going to have this knee replacement anyway, but we're still going to help you with your pain. We're still going to help you be as functional as possible, so that when you come out of your knee surgery, now you're in a much better place than someone that didn't do that.
Makes sense. Once again, if you're just tuning in, it's Healthcare Today with the HSA. I'm your host, Chuck Taylor. I'm talking with Miss Kristina Bramwell. She's over there at the HSA in the specific, and I want to say physiotherapy, but that is not exactly all of it. Sure. Tell me the department that you're in.
Therapy services. Which encompasses physiotherapy, occupational therapy, and speech therapy. Yeah. So again, talking specifically about osteoarthritis, which again is the theme for World Physiotherapy Day this year, September the 8th. Physiotherapy and occupational therapy would be the two main services that would help you with OA, more than speech therapy. Speech therapy is obviously more about communication, but occupational therapy is also a part of treating osteoarthritis sometimes, very, very case dependent.
Okay, excellent. We'll be right back in a few. Keep it locked in right here. We are Bobo 89.1 FM.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health, because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA. Now back to Healthcare Today with HSA and our host, Chuck Taylor.
Thank you for tuning in. It's Healthcare Today with HSA. I'm your host, Chuck Taylor, and we're talking with Miss Kristina Bramwell, talking about osteoarthritis, OA.
You said it perfect then.
I said it perfect. I'm working on it. See, you can always teach an old dog new tricks, which is kind of what we're talking about today, getting you better and getting you healthy. This is something, OA is something that will affect you over the course of your lifetime. Most likely, it's something, depends on, it's hereditary by some natures. And we were talking about the diagnosis of it. And I also wanted to ask, within that diagnosis, is food kind of in there also for understanding, well, if you eat, because we want you to be healthy. But then, we live in Cayman, and some of our food is not exactly the healthiest food, but, it is the tastiest. I will say that. But does food play a little bit into this? Tell me a little bit about that.
It definitely can. Having a healthy diet translates to so many things in your body, right? So it's you can't eliminate diet from your health and your wellness. There are, various studies that have come out over the years, promoting this supplement, promoting that supplement, saying don't do this and don't do that. And it's very easy to sort of get caught up in, oh my goodness, to be healthy, I need to do this and I need to do this and I need to do this. And it's very expensive. But basically the take home point is that you don't want a diet super high in refined carbohydrates. Carbohydrates are fine. A lot of people think that carbohydrates are the devil, right? But if you are eating, just rice and potatoes and stuff like that, that's fine. We're trying to stay away from very refined things, right? Things that are processed heavily, things that have a lot of sugar, etc. Those are the things that are going to help make you gain weight and increase your cholesterol and stuff like that. Right? So having a healthy, balanced diet, obviously I'm not a nutritionist by any shape or form, but having a balanced diet will definitely be a positive thing in regard to osteoarthritis. And we had mentioned weight a little bit earlier, and I'm always a little bit cautious when talking about weight because fat shaming is definitely a thing, right? And there are a lot of people that weigh, in ranges that we think are quote unquote unhealthy because BMI is still out. BMI is a measure that doctors like to use. It's basically height versus weight, right? And you get a number and, there's this scale. And if you're here, you're healthy. And if you're above it, you're not. And if you're below, you're also unhealthy because now you're too thin, right? And people get very caught up in that as well when, again, you could be a short, just muscular person and come out with a high BMI. But that doesn't mean that you're unhealthy per se, right?
Of course.
So again, a healthy diet will also help you maintain a relatively healthy weight, right? So diet definitely does play a part in the treatment of osteoarthritis from that perspective.
Okay. And I think that that's the thing that we want to push overall, that, you know what, having a balanced diet is healthy overall for no matter what degree of tallness or shortness. You know, eating proper is across the board is going to be a benefit to your life, no matter what is the ailment or wherever you're going to go, whatever you may find. Eating healthy is definitely one of the pluses of it. Speaking of OA, one of the things that I was going to ask you about is, can we prevent it? Now that we have a understanding more of it, how can we help diminish the idea of it coming? Because as you said, somebody who is 60-year-old runner, you usually run as a versus sedentary, that's going to be a change. But is there some specific things that we can do to help, I guess, lessen the idea of getting OA in our future?
So I like that you said lessen and diminish, right? Because curing it and preventing it are things that I don't particularly like to talk about, because in general, like I said, most people are going to get it in some shape or form, because your body is ultimately the most beautiful machine, but at the same time, you use it and it is going to wear down to a point, right? But you can definitely lessen the effects of OA if you maintain a healthy lifestyle, which goes back to, eating well, making sure you get exercise, etc., right? Specifically exercise that has a little bit of resistance training in it, right? Because resistance training, which can be body weight, it doesn't have, I think a lot of times too, you say resistance training and everybody's like, oh great, now I gotta go get a gym membership, which a gym is a great way to do it if you are a gym person and that's your thing, by all means. But you can also do, just doing, say, squats with just your body weight is a type of resistance training. Right. You can have, a few bands or dumbbells or something at your house, and that's resistance training. It doesn't have to be this big technical endeavor that a lot of people think it has to be. But resistance training strengthens your muscles. So if your muscles are stronger, they are going to stabilize those joints. So even if you are doing these sort of high impact activities like running and jumping and other things like that, your joints are really stable. So you're not going to get that bone on bone contact that someone with more unstable joints is going to get, right?
Okay.
So exercise, specifically resistance training, definitely can make a big difference as well.
And I think that's the thing that we here in Cayman have the ability to be an active society. We
beautiful weather all year. You can go outside and do it.
And resistance could be swimming. It could be something as simple as going, if you have access to a pool or the water, depending on the time of year, things of that nature. It's all about, I think, in a nutshell, moving. And moving in some sort of fashion. And hey, get a smartwatch and walk the steps in your office rather than taking the elevator and things of that nature. Those things a little bit helps. It goes a long way. And we don't think about it, but I said to myself, imagine if I walked 2 flights of steps every day, 3 times a day. That's movement.
Correct.
That is movement for me, and that helps get my heart rate up. It helps do certain things that normally, if I wasn't doing that, if I was jumping in the elevator or as you said, riding the elevator, that takes time and takes off every day, 365 days. No, not because weekdays, but you're actually doing something. And they have measurements for that, folks. I tell people, I said, every now and again, weigh yourself once a month and see where you are, and then be like, and write it down, because we forget things. I'm a firm believer in writing stuff down. We're smart calculator and smartphones and things of that nature now, but get in the habit of keeping a record of it, because if you have pain on Tuesday and then next week Wednesday you have the same pain, you don't remember that you had it last week Tuesday. So we're talking about being vigilant and having the opportunity to help you. And also, what are some of the offerings, speaking of help, what are some of the offerings that we can look forward to over at the HSA if we do get diagnosed with OA?
Right. So the underlying part of rehab, what we're always trying to get to with rehab is movement, exercise, specific things like that, because those are the things that are going to make a lasting change in your body. But again, if you have pain, we have to deal with the pain so that we can do these things, right?
Okay.
So arthritis responds very well to heat, usually, right? So at the therapy department, we have heat in the form of hot packs. We have what we call a hydrocollator, which is basically a big tank filled with extremely hot water that we soak our hot packs in, right? So it's moist heat, which is a much deeper and soothing heat than dry heat, right?
Okay.
So we have hot packs. We have paraffin wax. People that have, say, done pedicures and manicures at various spas and salons are familiar with that, but it's very, very good for uneven shaped joints. So like, for example, if I had a hand patient, okay. I would use the paraffin wax. I would have them dip their hands in it, get a good coat, and they could sit with that versus using a hot pack just because the shape of the hand, right?
Exactly.
But that's another thermal modality. We also have a low intensity laser that has an anti-inflammatory protocol. It also has an osteoarthritis protocol. So in some instances, we use that depending on the patient and their situation, right? We have two other machines called the short wave. The short wave is another form of heat, and it goes quite deep, right? And it's another modality that is very good for oddly shaped areas, right? And then we have the shock wave, and then we have a whole gamut of exercise equipment. We've got cardio equipment, we've got free weights, we've got bands that when your pain is controlled, then you move into your exercise to strengthen, stretch, do whatever your therapist has decided is going to help your individual situation.
On average, how long is a therapy session? Is it based on how deep the pain is, or is it just on average, you come in and you can do a normal 15 to... Tell me about that. What does that look like?
So most assessments, so like the first time you come in, usually your first session is going to be about an hour because you're going to sit with your therapist. You're definitely going to have a conversation. They're going to ask you about your pain, your lifestyle, your goals for therapy. And then they're also going to do an objective assessment where, as we spoke before about range of motion, how is this joint moving versus how your other side is moving? How is this joint moving versus how it should be moving, from a textbook perspective? What's your strength like? Are you able to, get in and out of your chair comfortably? Can you climb stairs? We're going to look at all those things, and then we're going to come up with a plan of care. So that's your first session, which, like I said, give or take is usually about an hour. Subsequent sessions then can range usually from 45 minutes to an hour, depending on your situation. So usually those longer sessions are more reserved for neurological patients, like people that have had strokes and traumatic brain injuries and stuff like that, because those types of people, usually their movement isn't that good. So, it's going to take them a little longer to even get into the department. So you have to plan for that, right? It's going to take them a little bit longer to move in between the exercises in the gym that you have set up. So you plan for that, right? Also, a neurological patient, you do have to give them a lot of rest, right? Because the nervous system, requires some rest also to heal. So, you're giving them breaks in between their exercises, right? So that type of patient is usually going to be booked in for an hour just because of the time it takes for the session. Someone that, say, is more orthopedic oriented is probably going to be on that kind of 45-minute session time frame.
Do you find that you end up treating more than one thing at the same time?
Definitely.
because you were just talking to me, and even though we started with the idea of OA, osteoarthritis, we ended up with a bunch of other names that I'm thinking, that's something totally different than what we're starting with. So you have patients that have multiple levels of pain in different areas, but OA is one of them.
Right. And then, so OA, like we said before, is wear and tear in a joint, specifically the surfaces of the joint, bone and cartilage, right? But again, going back to the example of a neurological patient, right? You could have someone that had a stroke, so that is the main thing that you're treating, right? But they're 70 years old, so they also have knee osteoarthritis. So now that
Okay.
plays into how you are putting together your plan of care for that person, because now you have an orthopedic issue that is going to change your rehab plan for your neurological issue.
Okay. Wow. And I would want to think that this is some later life issues, but then it can also happen to younger folks also.
It can. I remember a few years ago when I first started at HSA, I had a young patient that had an underlying condition. So again, this is a very special situation because not everybody had this particular underlying condition, you know. And he had to have a knee replacement at 15.
Wow.
Right. But again, very specialized situation. Right. So his joints wore down much quicker than the average 15-year-old because of this underlying issue. So again, we do tend to think of osteoarthritis as something that impacts older people, which it does, because, you know, like we've been saying throughout this whole conversation, you know, it is a wear and tear type of thing. Right. But you can also have it in younger populations as well for various reasons.
Okay. Understandable. And folks, if you're just tuning in, we're talking about I had it right just about 5 minutes ago, osteoarthritis, and they're having their World Physical Therapy Day. What day is that officially on?
September the 8th.
September the 8th. And I'm talking to one of the persons in the know, Miss Kristina Bramwell. Thank you so much for spending the time with us. And if you had one thing to tell people about OA, what would that be?
Don't be scared. It's very treatable.
Very treatable. And once again, folks, this goes back to the understanding that this may be something that you've never heard of before in your life, but it's something that in your lifetime you will occur. It will be a part of it, depending on your lifestyle and depending on numerous factors, hereditary things. But the thing to start with is it's treatable. Go see your doctor, get educated in it, because education, I think, is one of the things that will help you understand where you at with this. And is there some sort of book or how can we get a little bit more educated on this? I mean, I know outside of the doctor, and I don't want to take away from making sure that you see a healthcare profession and making sure that, you know, you are in the know from them. But I wake up in the morning and I'm not feeling 100%, but I dismiss it. When should I start to think about seeing a healthcare professional?
Well, as you kind of alluded to, you know, before, tracking things is a good way to kind of help your decision-making process, right? So, you know, again, we're all going to have aches and pains, right? Like, I mean, you sit on a long flight to go somewhere and you might get off the flight and your neck is a little sore, your knee is a little sore or something like that, right? Because you've changed altitude, you've sat for long periods of time, you know, there are many factors as to why you feel the way that you feel. But again, something like that is tied to specifically what you did in this short-term period, right? It shouldn't be that your neck is sore for weeks and months after your flight, right? That would, to me, indicate some type of underlying issue. So if you feel something, right, I wouldn't say jump and run and go to your doctor immediately, right? But track it, you know?
Okay.
So it's like, got up today and my neck feels kind of, you know, a little bit off. All right, so I'm gonna write that down. You know, this morning I felt like this, right? So then you can track, am I always feeling like this in the morning? Or am I noticing this at other times? And you can kind of, like I said, that will assist with your decision-making process. What I usually like to ask patients as well when they come in for their assessment, and then I usually ask this throughout the treatment, because pain, like we said before, is very subjective, right? But because it's individual, a good way to measure it is I usually ask people, what is your pain like today on a scale of 0 to 10? 0 is no pain, and 10 is the worst pain you've ever felt in your life. I always kind of joke around and say that nobody should say 10,
Right.
because if that's the worst pain you've ever felt in your life, that means you should be giving up the ghost as you're talking to me, right?
Of course.
But obviously, the lower you are on the scale is less pain, the higher you are is more pain. And because I'm asking you this specific question, right? Even if you have a very high pain tolerance and you're like, well, you know, it's a 3 and it's something that would be a 9 for me, if your pain is going down, then the next time you should be saying 2, 1,
One,
etc.
right.
Because we're talking about your individual experience, right? So if you're doing that little documentation, I got up today and my neck's kind of hurting. It's a 3 out of 10 today, right? And you
Right.
feel it again in a few days, but now it's a little bit more, it feels like a 5, and if it keeps heading closer to that 10,
Right, the
maybe
increase.
something is happening, right?
And I think as we talk, people, you have to be very acutely aware of your body too.
Which a lot of people aren't. It's definitely a process.
Yeah, and that's the thing. We're kind of scared to even have this conversation. People are always, I don't want to go to see a doctor. I don't want to do this. I've lived with this, but that's just it. You don't have to be living with this. You can be in a better place with the right understanding and the right treatment.
Definitely.
And I think that's the thing that you are providing on so many different levels. It's not just one, I'm sure every day is different, but then it starts off with the understanding of you're helping somebody overcome this particular item that they're dealing with. Off the grid, why did you get into this particular field?
So my grandfather, my maternal grandfather, so the Caymanian side of my family, my father's side is Jamaican. So I was much closer with my maternal grandparents growing up than my paternal. And my grandfather, who I used to call Papa, had polio. So apparently, that would have probably been like the 1940s or so. Polio was quite rampant in Cayman, right? And, for the most part, I hesitate to say eradicated because polio has now kind of resurfaced in the first world because there's been some cases, I think, in New York and stuff like that. So it's definitely not truly eradicated, but it's not rampant like how it was in those days, right? It is a virus. You do get sick, and then most people recover from it, but you're left with some type of physical deficit, right? So my grandfather, it affected his legs more than anything else. So he was quite, old people, like because I have some patients, obviously, that knew him. He's now passed, but that knew him, that used to say, oh, yeah, your grandfather was the lame man from West Bay, because, and again, they don't mean anything by it, even though lame has this negative connotation, right?
It's
but
just their ways of talking.
So he walked with 2 canes. Like from I knew him, he walked with 2 canes. Because of the weakness in his legs. And then if he was going long distances, and looking back at it now, this was insane technology for those days, right? But again, it was completely normal for me because he just had himself set up, right? So if he was going long distances, he had his little scooter. He had a modified truck, this old Ford white, I want to say it kind of looked like an F-150, but maybe it wasn't an F-150, it was an old one, right? And he had it modified that he could change the gears. I mean, now this is normal to us. A lot of trucks, you can change the gears from the handle.
Right.
But how his was set up was that he was changing the gears from the handle, but it had this contraption that went down to the pedals. Right?
Okay.
So it wasn't like how we know of changing gears at the handle now, right?
So it literally pushed the clutch in.
Right. Like I said, I don't know where he got this stuff from because this is way back in the day. Like I would have been a literal child, right? But this man was set up. So despite his disabilities, he led a completely normal life. Like he was a business owner. He had his children. He built his house. He built a boat. Like, I mean, he was a very functional man. And so I have never been uncomfortable with disability and modifications and stuff like that. So I think that's kind of what sort of geared me towards this type of profession.
Right.
Obviously, as you get into the profession, you learn that, there are so many other things out there. Like, I also want to mention that, a lot of people think that physiotherapy is just back pain, knee pain, neck pain, stuff like that. But I mean, there's pediatric physical therapy, right? Like we have 2 pediatric specialists in the department, and they deal with, developmental delay, cerebral palsy, Down syndrome, autism, many things that typically affect our younger population, right? We have 2 neuro specialists. So they specialize in neurological injuries such as strokes, traumatic brain injuries. Well, cerebral palsy, again, is technically a neurological injury. It usually affects you in childhood, but then it doesn't go away. So then as you start to age regularly, different things crop up now because you have a different neurological system than someone that doesn't have cerebral palsy. We have We also have three. We say women's health specialist, but really it should be pelvic floor specialist because men also have a pelvic floor. So things like urinary incontinence and pelvic pain and stuff like that don't just affect women. It is more common in women because obviously women, go through more regular hormonal changes. Women give birth, things like that men don't go through. But men also have a pelvic floor. So really it is pelvic floor physical therapy. So there are so many avenues and so many things that physical therapy, physiotherapy can help you with.
Right. And I think, part of understanding a person's passion is knowing where it comes from. And what you just, divulged to us is very passionate because you grew up with this, so as you said, where some people may be a little squeamish about it, you're okay with it because you saw this growing up and you're understanding that, that they can live a common, very ordinary but happy life with whatever disability, with the right modifications, and also the right attitude. I think that is part of people getting better is knowing that the person that they're working with is helping them build the right attitude towards the rest of their life. You understanding, say, hey, you know what? It may be kind of hard now, but it'll get easier. It'll get better. It'll get more. The repetition that you're doing is going to help you get stronger and help you lead a more productive lifestyle and pain-free. I think that you give that to them also. So, thank you so much for doing what you're doing and loving what you do. Once again, in closing, any final words?
Thank you for having me. I hope this was helpful. It seems like you learned a lot. You're much more comfortable with pronouncing the word.
I am. And you know what? I've always been a little skittish about the medical field. It is overwhelming. Definitely. I'm one of those. I've always respected the field of medicine because it has changed so much in my lifetime. So thank you for doing what you do and continuing to make people's life better for the love of being you. Thank you so much.
Thanks for having me.
Once again, thank you so much for listening in. Healthcare Today with HSA on Bobo 89.1 FM.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.
HSA's cardiology clinic is now located at Smith Road Medical Center. Our cardiology team provides expert care and treatment for heart conditions such as coronary artery disease, heart failure, arrhythmias, hypertension, congenital heart diseases, among others. The new location offers state-of-the-art cardiac diagnostic testing, including echocardiograms, ECGs, and stress tests. To contact, call 949-8600. At HSA, your heart matters to us.
The Health Services Authority's new pharmacy is now open at the Smith Road Medical Center. The new location features a large, comfortable waiting area and ticketing system to improve the patient experience. All uncollected prescriptions and refill requests previously submitted will now be available for collection at the Smith Road Pharmacy. Request your refills online at hsa.ky via WhatsApp 925-6532 or call 244-2715. For more information about our pharmacy hours, visit hsa.ky.
The Cayman Islands Health Services Authority's general practice and public health clinics have relocated to Smith Road Medical Center. At the new location, you'll receive top quality care in a comfortable, modern space, enhancing your patient experience. Do you have flu-like symptoms or other non-emergent illnesses or injury? HSA's new urgent care walk-in clinic is now open at the main hospital campus. The new general practice location is for appointments only. For more information, call 949-8600 or visit hsa.ky.
At the Health Services Authority, we want to keep you informed about the latest developments that impact your health because your health matters to us. Join us each Friday and Saturday from 1 to 2 p.m. as we cover health news, offer advice, and answer your questions on Healthcare Today with HSA.